Hi, I'm Dr. Priola. I'm a pediatric orthopedic surgeon here at Shriners Hospital in Twin Cities. Recently, we started a sports injury and fracture or trauma clinic. We see kids 5 days a week. We guarantee that they'll be seen by one of the pediatric orthopedic surgeons here at the time. It's a walk-in clinic or by appointment, and we see all sports injuries and we see most fractures. We like to say that kids are not little adults. Their skeletons are very different. Their growth plates are open. The growth plate is actually the weakest part of a child's skeleton, and so a lot of the sports injuries occur from overuse that occur at the growth plates, or if they do have a sports injury or fracture, the fracture patterns or the sports injuries are significantly different than adults. For instance, if an adolescent were to dislocate their shoulder, they will typically tear the tissue surrounding the shoulder that helps keep it in place, whereas an adult will typically get a rotator cuff tear. And we know that children who dislocate under 20 years of age have an 80 to 85% redislocation rate. That has to do with the type of injury that they sustained with the dislocation. So adolescents are treated much differently than adults for shoulder dislocations as far as the injury pattern. So the services that we offer here, of course, would be if a fracture needs to be reduced, we take the child to the operating room and put them under general anesthesia and put the fracture back in place, and either have to perform a surgery for maybe a displaced femur fracture or a displaced tibia fracture, even a displaced forearm fracture, or sometimes we can get away with just putting a cast on in the operating room. A lot of the injuries that we do see, maybe a 2 or 3 year old with a small fracture of their leg called a toddler's fracture, doesn't require surgery, but we immediately take them back to our cast room and we'll put a long leg cast on them to treat a toddler's fracture. They come back in 3 weeks and we put a short leg weight bearing cast on. In 5 weeks they're good. Every child who comes in that needs rehab or physical therapy can be seen the same day, and they also see the kids here following injuries or surgery. A lot of my practice involves ACL reconstructions or treatments of knee dislocations, and our staff here has a specific protocol that they follow, and the kids will receive accurate and reliable rehabilitation after surgery or a sports injury.